Welcome to the updated Dr. Bernstein podcast. Please check the description for the original sources, and all content is general in nature and should not be considered medical advice.
Today, we're diving into something kind of interesting.
Okay.
It's a topic that always seems to spark debate in the diabetes community.
Yeah.
Statins for type 1 diabetes.
Right.
Dr. Bernstein.
Yes.
He's all about that strict blood sugar control, and he's made his opinions on statins pretty clear.
He certainly has. Dr. Bernstein's clinical experience had led him to believe that statins might not be necessary for preventing heart attacks in people with type 1 diabetes, especially if they're managing their blood sugar well.
Exactly. He's actually quite skeptical of the famous Framingham guidelines, which many doctors use to assess heart attack risk.
And he's not just dismissing them. He has some pretty specific critiques. Dr. Bernstein argues that those guidelines overestimate the risk for individuals with type 1 diabetes. And to his point, they do rely on data that's getting a bit old.
Yeah, they are a bit outdated.
He's not a fan of how those guidelines are used, that's for sure. He'd rather see more emphasis on what he calls alternative risk factors, especially when it comes to inflammation. This is where it gets really interesting for me because we're talking about looking beyond the usual suspects like cholesterol.
Absolutely. And he points to markers like lipoprotein, small.
Lipoprotein small?
Yeah.
I've heard that one before, but remind me what that is again.
You might be wondering what that is. It's basically a type of cholesterol that's been linked to heart disease, even more so than some other types.
So that's one example. But he also talks about fibrinogen, which plays a role in blood clotting. Dr. Bernstein seems to really be zeroing in on anything that could contribute to inflammation in the body.
And this ties directly into his belief that lifestyle interventions are key for folks with type 1 diabetes. We're talking about things like a low-carbohydrate diet and regular exercise, of course, with your doctor's okay.
Of course.
And he's a shining example of walking the walk himself. He's 81 years old, exercises rigorously, and credits this lifestyle for his own heart health. Talk about inspiring.
He really is. He's not just advocating for this in a vacuum. He's living it. And he's seen it firsthand with his patients. In fact, he tells this story about a patient whose insurance company insisted on putting them on statins.
Even though all of their heart health markers looked good.
Yep. Clean coronary artery calcium score,
Yeah.
clear CT angiogram, you name it. They had it all clear. But the insurance company was sticking to those guidelines.
It really highlights how sometimes the guidelines and what a doctor might recommend for a patient can clash, especially if there are other factors at play.
It certainly does. But it begs the question, what does the research actually say? Because we dug into some recent studies on PubMed, and it paints a slightly more complex picture than what Dr. Bernstein sees in his practice.
Right. So we've got Dr. Bernstein's clinical experience on one hand, and then we have these research studies that, while they don't necessarily contradict him completely, do offer a different perspective. What's so fascinating to me is how we reconcile those two things and figure out what it means for someone with type 1 diabetes who's trying to make the best decisions for their health.
Absolutely, and that's exactly what we'll unpack as we delve into these studies. So this study from the Journal of Translational Medicine,
Okay.
just this year, 2023.
Wow, so recent.
Yeah, just came out.
Yeah.
And it found that statin use was linked to a lower risk of heart problems, like heart attacks or strokes,
Okay.
in people with type 1 diabetes.
Which on the surface seems to go against Dr. Bernstein's observations, right? Sounds like we have a conflict here.
It might seem that way, but it's not that simple.
Okay.
Even this study acknowledges that more research is needed.
Oh, really?
It's like they're saying, hey, we found this connection, but let's dig deeper before we draw any firm conclusions.
So one study isn't enough to completely overturn years of someone's clinical experience, right?
Exactly. And to make things even more interesting, there's a 2016 observational study from the Journal of Clinical Lipidology that throws another wrench in the works.
Another wrench?
Yeah, this one suggests that statins might actually worsen insulin sensitivity in people with type 1 diabetes.
Oh, really?
Yeah.
Okay, so now we have two studies with slightly different conclusions. For our listener, this is starting to sound like we don't actually know anything for sure. What are they supposed to do with this information?
That's the million-dollar question, isn't it? And it highlights why just looking at a study's headline conclusion doesn't give you the whole picture.
Right.
You have to dive into the methodology
Wow.
and limitations.
Mm-hmm.
For example, this 2016 study was observational,
Observational.
meaning it can show correlation, but not necessarily cause and effect.
It's like finding clues at a crime scene. They could point you in the right direction, but you can't solve the case with just a couple of fingerprints.
Precisely. And to further complicate matters, There's a lack of large scale.
Okay.
Long-term studies specifically on how statins affect younger people with type 1 diabetes.
Oh.
Most research focuses on broader populations, which might not translate perfectly to someone who's had type 1 since childhood.
That makes sense. Everyone's individual biology is different, especially when we are talking about something as complex as diabetes. So we have these broad strokes, but what about the individual? Weren't there any interesting studies looking at how to predict risk on a more individual level?
There was one from 2023 in the J Diabetes Complications Journal.
Okay.
It found that while about 1/5 of the type 1 diabetes patients studied had calcium buildup in their arteries,
Right.
which is what a coronary artery calcium score measures, by the way.
Right. It's a mouthful, I know, but important for measuring heart health.
Exactly.
Yeah.
So this study found that a different tool,
Okay.
the Stenotype 1 Risk Engine, or ST1RE for short,
Sire.
ST1RE,
Okay.
actually did a better job of predicting who'd have that calcium buildup compared to the European Society of Cardiology guidelines.
So to be clear, that's ST1RE. ST1RE for anyone who wants to look it up themselves. So this ST1RE thing, that was more accurate than the more established guidelines.
In this particular study, yes.
Okay.
And that's huge. It suggests we might need to rethink how we assess heart attack risk, especially for those with type 1 diabetes.
So we have these different approaches, Dr. Bernstein, with his emphasis on lifestyle and individual assessment, and then these research studies exploring various aspects of statin use and risk prediction in type 1 diabetes. Where does this leave us? And more importantly, where does this leave our listeners who are trying to make sense of it all?
It's tough, right? Like, we're trying to figure out what to do, and it's like, should I listen to this guy who's been doing this for years, or should I listen to these studies? It's a lot to think about.
Right, and that's what makes this such a fascinating topic to discuss, because it's not always black and white.
It's not like, here's the answer, everybody do this.
Yeah.
And that's what we're seeing with type 1 diabetes and statins in particular.
So for our listener who's living with type 1 diabetes every single day, how can they use this information? What should they be taking away from all of this?
Well, I think the biggest thing is, and it always is, knowledge is power. The more you understand about your own health, the better equipped you are to make decisions.
Love that.
So, being informed, doing the research, listening to podcasts like this one, and then taking that information and having a conversation with your doctor.
Right, and not being afraid to ask questions.
Absolutely.
Like, hey, I heard this on this podcast. Can we talk about this?
Exactly. Because they might not bring it up to you. Doctors aren't perfect, and they don't know everything, and everybody's different, so...
And you are your best advocate
Yes,
for your health.
100%.
So you really need to take charge. Yeah.
So, don't be afraid to ask those questions. Don't be afraid to ask about those alternative risk factors that Dr. Bernstein talked about, those inflammation markers.
Have that conversation. So I think that's a really good place to leave it today. If you're interested in learning more about Dr. Bernstein's approach or about those studies that we mentioned, we will have links to all of that in the show notes. And as always, please remember to like and subscribe, and thank you for listening.